Myself and the rest of the investigator team were absolutely thrilled, obviously, to be given this opportunity. When we looked at our own hospital data, we were seeing that, approximately 5,000 patients were referred over 2 years, and 3/4 of those patients were triaged as the highest category, category 1, which means that their colonoscopy needs to be done within 4 weeks. And that's extremely challenging for a public hospital to meet that demand and to achieve those standards set by national bodies. So it's essentially impossible to meet those criteria. And this situation has been obviously massively impacted by the COVID-19 pandemic, where we've had obviously closure of endoscopy lists, which means more people are on the waiting list, and all these problems have been exacerbated. So we wanted to make sure that patients who are at the highest risk of colorectal cancer could access these services in a timely fashion. And in our initial pilot studies, we showed that we could differentiate blood from patients who have colorectal cancer and those who don't. And so we're looking to translate this technology into a clinically useful tool to tell us how best to help us stratify a patient's risk of colorectal cancer. So when we look at those 5,000 patients on the waiting list, we potentially add this blood test, ask them if they would like to do this blood test, identify those who are at the highest risk of cancer, and get their colonoscopies expedited so they can get early diagnosis, early intervention, and potentially more effective treatment. As an investigator group, we're extremely grateful, and we recognize that a lot of this funding comes from hard work of people on the ground who are doing fundraising activities or generously donating, money themselves. So we're extremely grateful for that, and I think also, that comes with a burden of responsibility. We're grateful of the trust that the fundraisers and AGITG have placed in us. And we're, looking forward to generating some impactful research that's going to improve patient care and repay that trust and acknowledge the responsibility. It's driven by a clinical need that we're seeing every day in the hospital. We're looking after patients, so we're always desperate to meet that clinical need and to improve patient care. And it's really exciting to be given the opportunity to do that with this translational research. So.